Hey guys, today we're going to talk about knee replacement surgery. We'll talk about what to expect before going into surgery, what they'll do in surgery, and some of the things you'll be doing right after surgery. So let's get into it. What's up guys? Aaron Kasner, Doctor of Physical Therapy. Today we're going to talk about the knee replacement. So many people suffer from arthritis and it gets bad enough to where the joint needs to be replaced. But what does that mean? What is happening in the joint? What are the doctors doing? What are they taking out? What are they putting in? How long is it going to take? How much pain am I going to be in? All of these questions are swirling around in your mind, I'm sure. Okay, so let's go over that. Let's ease some of that discomfort, ease some of that fear to know exactly what's going to go on without it being too graphic. We'll just use some models so I can show you where they're going to be putting in the new joint and how long it's going to take. So let's get into that. So with a knee replacement, they're not taking out the whole knee or anything like that. They're just trying to correct the joint. So they're going to go in and they're going to fix the areas that are causing the biggest issues. They're going to have to take out part of this and part of this bone. So your tibia and your femur, they come together. You got to replace that joint surface. So where these joints come together. And then all these ligaments in your meniscus, that's going to be gone too. All right. Now, how they do it is they'll come in and they'll shave off some of this bottom bone, shave off some of this top bone, and then they'll put metal directly into the bone, okay, on the tibia and on the femur. Then they're going to put a plastic piece that sits on the tibia as well. Now, with all of that, they're going to use bone cement. So that solidifies pretty quickly, and it helps keep that joint in a good, solid foundation, all right? They're also going to put a plastic piece across your kneecap. That way, with the metal that's going to be here in this joint, it'll slide nice and smoothly. What they'll do is they're gonna measure your joint and find out which prosthetic is going to be best for you. They don't want too big of a joint in there, otherwise it may make it hard to bend the knee. All right, and too small, it's not going to be comfortable either. It won't fit congruently, and that could be an issue as well. Okay, so the surgery, including putting you under with anesthesia, doing the surgery, getting you sewn back up, and then going into the recovery room, takes about 2 hours, give or take. Kind of depends on the size of the person. It depends on if there's any issues or complications along the way. Typically, there's not though. Typically, these surgeons are really, really good at what they do. They're in and they're out. They know exactly what they want. They put that joint in and then get you on your way. Now, after surgery and the recovery, it's pretty quick. So what they do is you'll be recovered, you'll go and you'll wake up, and they'll have you in your room. PT may come later that day and get you walking. So you know that joint is in a good spot. You know that joint is solidified. It's not going to move around. You're not going to hurt anything. As long as you are up and you're moving, you're being safe, you're going to be fine. Now, being in the hospital, you may be in the hospital 1 or 2 days, depending on how you do. Physical therapy is going to come in. They want to make sure that you're up and moving. They want to know that you can get up out of bed. They want to know that you can walk functionally. So around your house, being able to do everything you need to do, such as going to the bathroom, sitting down on a toilet, standing up from a toilet, walking hallways, things like that. They're going to make sure that you can do stairs as well, because if you have a couple steps to get into your house, then you need to make sure that you can do that. Now, here's a little hint when it comes to stairs. So you don't want to load that knee too much, only because it's not going to feel good. All right. All those nerve endings are super sensitive right now because, well, you just got cut on, right? The doctor went in there, opened up your joint, opened up your knee, and all those nerve endings are firing like crazy. So it's going to be sensitive. It's going to be tender to the touch. It's going to be tender putting weight on it, but you're not going to hurt anything. But a way to make it easier, with stairs, you're going to go up leading with what we'll call the good leg. So the leg that wasn't operated on, your stronger leg right now, you're going to lead with that knee, all right, and that leg. So you'll step up and then bring your operated leg up. And then step up on the next step, bring your operated leg up. Okay, you're going up with the good leg. Now when we go down, you're going to lead with the operated side. So the bad leg. It's not really a bad leg, but that's how we're gonna refer to it, just so it makes sense for you. So you're gonna go down with the bad leg. So if you're on the top step, what you're gonna do is you're gonna lead with the operated side, keeping that knee nice and straight, controlling your descent with the good side, and then you're gonna bring it down. And you're gonna go down to the next one, nice and straight knee, and then you're going to use this knee to control it all the way down. Makes it nice and easy. You'll probably be using a walker or something like that just to help take some of the weight off of it. That's completely normal. Don't think you're going to be stuck with the walker for a long period of time. You're going to use it for as long as you need to, which some people are gone from that in a day or two. Some people may take a week or so, depending on how sensitive that knee is. If you've been dealing with knee pain from arthritis for years and years and years, that knee is probably pretty sensitive. Okay, so it may take a little bit longer. Don't judge your progress based off of somebody else's progress. Even if it's the same surgery, 2 different knees. Could be 2 different surgeons. Could be 2 different prosthetics. 2 different everything, okay? So don't judge yourself based off of what somebody else has experienced. This is your experience. In fact, I've had patients who they've had one knee done by one doctor and it went really, really well and it felt fine. Then they go in a year or 2 later and have their other knee done by the same doctor, everything seemingly the same, and it was a rougher recovery. And vice versa. It's been rough for them at first and then great the second time. It just depends, right? A lot of things are at play when it comes to pain. So don't think that you're struggling too much if you're still in pain. That's okay. It'll get better. You got to keep working, keep being active, keep doing your physical therapy, and keep growing. So that's all I have for today in today's video, but I'm going to keep talking about knee replacements. I'm going to talk about the exercises you should be doing, talking about recovery times, the different phases you'll be going through, some little hacks too to help make it easier in this recovery, and a bunch of other stuff. So if you want to learn more, click in the playlist. I have, like I said, a complete series of all of these things, and you'll learn more and more about it. All right, thanks for tuning in. See you next time.